Traditionally, in radiation therapy, there are difficult trade-offs to consider whenever there are concerns about target motion during treatment. Clinicians are usually forced to consider where to make sacrifices. Do they restrict the patient movement to reduce margins, but in doing so compromise the patient's comfort? Or do they opt for a larger treatment margin, increasing the risk of potential side effects? Perhaps they decide to pause treatment when motion occurs at the cost of a lengthy treatment procedure. This choice is typically predefined by the system. Conventional radiotherapy systems have generally been designed to optimize one goal at the expense of others. Conventional motion management, or motion compensation, is all about attempting to make up for deficiencies in treatment delivery. As noted, this means there is a built-in conflict that leads to trade-offs and sacrifices. Accuray enables a completely different approach to intrafraction target motion that shifts the paradigm: motion synchronization rather than motion compensation. Synchrony delivery adaptation allows fully automated target tracking and beam correction, synchronizing beam delivery with target motion in real time, with no need to pause treatment. This technology is available on both CyberKnife and Radixact systems. This enables more accurate, more efficient, and more comfortable radiation therapy treatments for patients without compromise. Synchrony gives you confidence when dealing with targets that move. It takes away the pressure of forcing clinicians to make difficult trade-offs, allowing them to prioritize both patient comfort and maintain efficient treatment delivery, while simultaneously minimizing margins. As you can see, a Synchrony plan can reduce the treatment volume by more than 68% compared to a standard lung plan that uses an ITV to compensate for target motion. This means significantly reduced dose to healthy lung tissue, sparing 62% more lung tissue from receiving greater than 20 gray, and sparing 30% more of the contralateral lung from receiving a dose greater than 5 gray. This ability to reduce treatment margins with Synchrony, and therefore spare more normal tissue, plays a significant role in mitigating the risks of pulmonary toxicity and potentially reducing significant acute and long-term side effects for patients. The global cancer burden is growing. It is estimated that the global economic impact of cancer is now over $1.6 trillion annually. Of those patients diagnosed with cancer, 50 to 60% will require radiation therapy at some stage. The wealth of information available to patients gives them more choice in the management of their disease, and patients often have many treatment options available to them. More choice can lead to higher expectations in the treatment approach they choose. Service providers continue to be faced with critical challenges in cancer care. Evolving standards of healthcare, including trends towards value-based reimbursement, means patient satisfaction becomes even more significant. Hypofractionated radiation therapy can allow clinicians to confidently deliver more precise treatments in shorter courses of treatment that put patient experience first. The planned treatment volume, the target that receives a high dose of radiation, depends on the size of the tumour, the amount of movement it displays, and the level of confidence that the clinicians have that the chosen delivery method will hit the target as it moves. Hypofractionated treatments planned using Accuray's Synchrony real-time delivery adaptation capability on either CyberKnife or Radixact systems track the target movement in real time and synchronizes the treatment beam with the actual position during treatment. This capability, not available on any other radiation therapy system on the market, gives confidence that the treatment will hit the target, enabling clinicians to reduce the amount of healthy tissue included in the treatment volume and deliver higher doses per fraction, whilst also potentially reducing side effects. Higher per fraction doses reduce the total time required to deliver a course of treatment, which in turn reduces the cost required to treat a patient due to the need for fewer clinical actions. Hypofractionation offers numerous benefits to both patients and providers. Patients receive high-quality treatment in fewer visits, meaning less overall impact to their daily life. A reduction of the amount of normal tissue included in the treatment field can reduce treatment-related side effects so that patients can return to their normal life faster. Reducing the time needed to deliver a course of treatment can also increase overall departmental capacity, potentially increasing the number and types of patients who could benefit from hypofractionation. Fewer visits mean lower costs per patient, leading to more cost-effective courses of treatment and therefore increasing overall profit per patient. In the age of value-based healthcare, hypofractionation empowers transformational change. It enables providers to increase their capacity, expanding treatment options to more patients, thus helping to address the global cancer burden. Fewer appointments for a course of treatment creates a better overall experience for patients with less impact on their normal life. Providers can deliver value-based care with optimized clinical outcomes whilst also being cost-effective. As we move towards a value-based healthcare approach, hypofractionation offers clinics a highly cost-effective treatment modality that addresses the economic and clinical challenges of the growing global cancer burden. Most patients diagnosed with cancer will need radiotherapy at some point, and hypofractionation provides an excellent clinical solution to meet the rising demand for radiation therapy without compromise. There is a growing body of clinical evidence to support the unique benefits of hypofractionation. Delivering higher doses per fraction in fewer total fractions achieves clinical outcomes comparable to conventional regimes. Hypofractionation enables a practice to provide an efficient, patient-centric approach to radiation therapy and builds a reputation for high standards of care that can attract other patients. Forward-thinking radiation therapy practices are leveraging hypofractionation to achieve a powerful combination of clinical and economic benefits. In conclusion, hypofractionation has benefits in elevating your patient's experiences. Smaller margins can mean fewer side effects from treatment. Fewer visits can reduce out-of-pocket costs and reduce the number of hours of missed work. And a faster, less disruptive treatment option allows patients to return to normal life more quickly. In addition, there are clear economic advantages for your clinic. Fewer fractions per patient allow the overall patient volume to be increased. A highly personalized and efficient treatment approach optimizes both treatment quality and total cost, both of which are important for value-based cancer care. And operational efficiencies can improve the economic bottom line.